I would, be careful about, just getting information from the internet that
Dr.
you don't know
Google,
what
avoid
source
Dr.
it came
Google.
from. Dr. Google, yes, avoid Dr. Google. So you got to make sure that you get the information, but you got to get it from the right source.
The MS Positive podcast is a platform where people living with multiple sclerosis come to share everything else they do with their lives aside from being an MS patient. Among our guests are artists, singers, bloggers, actors, authors, DJs, and much more. And yeah, also health professionals because we have to stay in the know. We're more than MS. I'd like to welcome Dr. Adnan Subei to the MS Positive podcast. He's a board certified neuroimmunologist specializing in the treatment and management of multiple sclerosis and other demyelinating and autoimmune diseases of the central nervous system at Neurology Consultants of Dallas. He was also the founding medical doctor of the multiple sclerosis program at Memorial Healthcare System in Hollywood, Florida, and the founding program director for the neurology residency. He's been a member of the National MS Society's Medical Advisory Committee since 2020. Dr. Subei has been awarded with the Program Director Excellence Award by Memorial Healthcare System in 2022. Also, the A.B. Baker Teacher Recognition Award by the American Academy of Neurology in 2023, and the Outstanding Healthcare Partner Award by the National MS Society. Dr. Subei is a fellow of the American Academy of Neurology, which is the highest title, should we say, that a neurologist could hold. So I'm honored to have you. Thank you for accepting my invitation. Welcome to the show.
Thank you so much for having me. I appreciate the opportunity.
I would like to start this conversation by saying that Dr. Subei is the MS Specialized Neurologist that diagnosed me 9 years ago when he was part of the Memorial Healthcare System in Florida. And I always felt privileged to be his patient for so many years. So thank you. And it was a great honor to be under your care.
Thank you, Mikey. I appreciate that. It was a pleasure taking care of you as well.
Thank you. So you were this year at the ECTRIMS conference, which happened in Milan, Italy. So lucky.
Good morning and welcome to MS Milan 2023, our 9th joint ECTRIMS meeting. It is with great pleasure that I stand before you today in this beautiful city of Milan.
How was that experience? Could you give us some highlights of the conference? I know it was 3 days, so there's a lot of information, but what caught your attention from what you heard over there?
Yeah, ECTRIMS is a great meeting. It's the largest international meeting for multiple sclerosis, and usually they present the latest research that's been done in MS. And this year it was in Milan, Italy. It was a great meeting as always. It's great to hear from experts about the latest research. It's great to see colleagues and collaborate with other people to help MS patients. The biggest theme I would say for this year's meeting is about progression in MS. And there are new concepts that we are now starting to understand. One is one that we've known about before is called relapse associated worsening, which is the worsening that tends to happen when people have relapses. But the newer term that has been introduced over the past few years is called PIRA, which is progression independent of relapse activity. And to simplify what this means is you have this patient who has not had any relapses, is on a great medication, has seemingly no MRI activity, everything looks okay, but then the patient continues to progress and decline. And this is what we mean by PIRA, progression independent of relapse activity. And now we're starting to understand more about this and the fact that it happens in many patients, even early in the years from diagnosis. And it's not necessarily something that is happening years down the road.
I was listening to the ECTRIMS podcast, and they mentioned that I think what I heard is that that's very much associated with secondary progressive MS because usually there is no MRI activity, there's no flare ups, but clinically the patient continues to deteriorate.
Exactly, as you stated. And so we're starting to understand this better, that the progression is happening without any MRI activity, without any relapses. And we're really starting to lean away from those categories of relapsing, remitting, secondary progressive, primary progressive, because we now believe that it's all just one spectrum and it's not necessarily into I was this, then I became that.
One of the doctors was mentioning, I think it's called the premonitory stage of multiple sclerosis, which is when MS is brewing and it has not yet attacked you. And they were talking about the importance of trying to figure that stage in advance to avoid that MS takes place or attacks or develops and avoid the damage that MS can cause.
Well, exactly. So now that we're starting to understand the mechanism behind the pathology and the pathophysiology of MS, then you start to wonder, okay, well, what is this phase that starts early on the disease before the first symptoms start to show up, so that maybe we're able to mitigate the condition and treat it before it even
And how
starts.
could that be identified? Like, how could you tell somebody is brewing MS in the background?
You're right, it is a challenge because technically you can't screen every single person in the world for MS, but perhaps in the future, if we're able to identify patients or people who are considered high risk for MS, those with family histories or who fit certain demographics, or have exposure to certain viruses, then you wonder about, okay, should these be the people that we need to test and investigate for
Is that
MS?
where biomarkers come in?
We are looking forward to several biomarkers, which, to sort of explain what a biomarker is, it is a test that we're able to obtain that will give us information about the disease itself. And for all these years that we've been in practice, we've not really, our main biomarker has been MRIs.
Right.
And so that would be the test that we used to get, and then maybe a spinal tap looking at oligoclonal bands at the time of diagnosis. But we've not had biomarkers that are via the serum or blood
Yeah,
until recently.
there's no blood test yet that can um, say if you are going to develop or if you are positive for multiple sclerosis.
Right. So we do have several biomarkers that are in research, and then some have been rolled out commercially that look at nerve damage. And so then you can quantify the amount of axonal damage, and maybe that can give us insight into the level of activity in MS. Of course, the challenge in that case is that as we age, we break down nerves, and so the biomarker increases with time. If we have other diseases than multiple sclerosis, if we have diabetes, hypertension, uh, dementia, and other degenerative disorders, those could also increase biomarker levels. So then it becomes challenging from that perspective. So there's a lot more that we're going to be learning over the years with regards to biomarkers.
Neurofilaments, it was brought up several times. It looks like it's something that's very important during research. Can you explain what they are?
So neurofilament light chain is a marker of neuronal breakdown. So when the axons get damaged and they break down, so one of the components is neurofilament light chain. And we now have an assay that's sensitive enough to test and measure the level of neurofilament within the blood. But then again, neurofilaments fluctuate throughout the day, throughout the days, and how do you know what any person's neurofilament levels should be? So that's where the challenge is. We don't have normative data at this time.
Is there a test that can tell you the levels of inflammation in a patient since MS is an inflammatory disease?
Yes, MS is an inflammatory disease, but then we have to remember is that there's two different compartments if we wanted to simplify things. We have the CNS compartment, which is in the brain, and then we also have the peripheral compartment, which is the rest of the body. So we have markers that measure inflammation in the periphery, like your older tests like sedimentation rate or C-reactive protein, but those don't measure the inflammation within the CNS, which is where MS is usually acting, and that's the challenge. There is a combined biomarker blood test that's been available recently. It's called the Multiple Sclerosis Disease Activity Test, and that we can send, and it will give us levels that show us the amount of axonal loss, degeneration, inflammation, and it gives us somewhat of an idea of level of activity.
So, if I understood you correctly, you are referring to the adaptive immune system, the B cells and the T cells, and the innate immune system, the one that has not been targeted yet by any DMTs.
Right, yes. So microglia are within the central nervous system. Yes, they are in a compartment that is very hard to reach. Now, normally, microglia are sort of your trafficking cells within the nervous system. They're responsible for cleaning up the mess and making sure the functions within the brain are intact. And so, in the process of multiple sclerosis, you have this microglial activity where they are responsible for activating B cells and damaging myelin disrupting axons. So, and we're now starting to understand this. So, one way would be to treat MS is to target microglia, which are responsible for this compartmentalized inflammation within the brain.
And that's when we start talking about the BTKs, because that's exactly what this new promising treatment for MS it's providing. It's actually crossing those boundaries.
BTK stands for Bruton's tyrosine kinase. It's a protein that's found within the brain, and it's involved in the activation of B cells. And so now that we're starting to understand more about microglia and progression, perhaps we're able to inhibit the BTK, so that way then we're able to turn off B cell activation and control MS and change progression while still retaining B cells. We're not killing them off. And we have several medications that are being considered as BTK inhibitors.
So, not killing the B cells means not so many infections. Then we suffer from a lot of, especially upper respiratory infections when we suppress our immune system with these DMTs that are available. So that will prevent that from happening.
That's our hope with the BTK inhibitors. Is the advantage would be is that we're retaining B cells instead of killing them off as we would with your standard CD20 drugs.
Is there anything else that caught your attention?
I think there were a few studies that have shown also about some other mechanisms of targeting MS, whether that's through a medication that targets the CD40 ligand, which is also involved in microglial activation. We have some information about biosimilars and other products that have been used outside the US.
Out of curiosity, is there any research about pediatric MS?
Of course, yeah, a big portion of the meeting is related to pediatric MS. So most of the understanding is about, progression happening in pediatric MS, which we now know occurs early on. So that supports the theory that progression happens early in the stage of the disease because children in general are able to hide symptoms very well. And many of the pediatric patients with MS don't show the typical signs that adult MS patients do, but we're now starting to identify that progression and cognitive impairment still happens in pediatric MS. It's just that we maybe brush it off or we don't investigate much about it.
These medications we know are very strong and they have serious side effects. How early can you start a child in a DMT?
So we have FDA approval for a medication to treat pediatric MS. Fingolimod actually is approved from ages 10 to 18 in pediatric MS. We have several other medications that have been tried in pediatric MS and hoping soon that we'll get FDA approval for them as well. And then we also use medications off-label, so that doesn't necessarily mean that we don't use if there's no FDA indication, especially for patients younger than 10 years old if they have confirmed MS.
Recently, the FDA approved a biosimilar Tyruko. which is biosimilar for Tysabri. How are biosimilars beneficial for patients?
Biosimilars are, in quotes, or sort of generic medications. They're not exactly generics. What a biosimilar is a medication that's formulated to have the same action or effect as a medication that's already branded, approved on the market. And so, in the case of Tyruko, which is natalizumab, and so it's supposed to work in the same way as brand Tysabri does.
Doctor, recently I have heard more and more often it's turning to a trend to stop MS treatment after you turn 65. I've heard that it has been even recommended by neurologists. What do you have to say about that?
So this is a very controversial topic,
Hmm.
and neurologists have debated this for many years. We actually have several research trials that have been done and presented to evaluate the safety or the need for stopping DMT after a certain age. Uh, Collectively, we can say that the answer is inconclusive, but there tends to be a higher chance of relapses developing when uh, we stop disease modifying therapy. So many MS neurologists will say that if we are tolerating the disease modifying therapy, we're not having any side effects, we're not having any cost related issues, then it's best to keep the medication going. But if we find any of those becoming an issue, and the most concerning would be is safety, tolerability, then I would recommend stopping.
Well, like you said, it's a topic that is debatable. They base this decision on the fact that the immune system gets weaker as you age, and so suppressing it with such strong medications, it's actually not good for the patient. It will actually cause the person to be at risk of getting other diseases because their immune system is weaker naturally, plus suppressed by the DMT.
Well, the question then becomes is how do you identify those who have weakened immune systems versus those who don't? So that's the challenge. Is there's no way for us to tell where someone is, and so if we seemingly are doing well without any infections, increased risks, then that's not the case. So then we continue treatment. But if we find that no, the patient is having significant uh, infections and other side effects to the medication, then I would certainly advocate to stop.
Does it make sense to be on a DMT? This is a question that many people have, especially the younger generations. If it's not going to cure MS, why should I be on a DMT?
We have a lot of diseases that don't have cures. We don't have a cure for diabetes. Why should we go on diabetic medications? The thing is not about a cure, it's about controlling the disease. We already know from years of having disease modifying therapies that we can make an impact on the disease itself. And we're able to significantly delay progression, we're able to significantly stop and slow down disability. Epidemiological studies will show you that in the past, you can say in the 80s and 90s, early 90s, before we even had, because our first DMT was approved in 93, is patients, many of them were bed-bound or wheelchair-bound. If you look at patients who are diagnosed in the 90s or in the 2000s, then many of them are in mobility chairs or using walkers. And if you look at patients as a whole in the 2010s, or so, then they are, using canes or maybe some of them not even. So this trend of a change in what the prevalence of MS is looking like tells you that our disease modifying therapies are actually making an impact, and we are delaying disability from happening much earlier.
Right. One of the things is the shrinkage of the brain, which is a natural process, but we know that with MS, we lose brain mass faster than average person. And so DMTs play an important role in slowing down the shrinkage of the brain.
Yes, and we have several DMTs that have been tested in clinical trials to show that they preserve brain volume as opposed to others or placebo. So we know that our disease-modifying therapies will preserve brain.
I was having a conversation with another support group leader that is very active in the community, and we were talking about the fact that patients don't educate themselves, therefore they're not good advocates for themselves. They don't really know the whole scope of multiple sclerosis. Do you think that the patients need to be more educated?
I don't necessarily expect patients to come in knowing everything they need to know about their disease. I do believe in shared decision making where me as a physician, I'm supposed to give patients the necessary information, teach them about their condition, and so that way we are both making a decision regarding their care appropriately, where they are informed, they learn, and they understand their condition, and then I'm able to give them our expertise to help them make the decisions.
That's because you're an awesome doctor. But the truth is that there's other neurologists that don't even take the time to explain multiple sclerosis to their patients, which I think it's completely wrong because your neurologist is your first contact and your source of information about, your disease that you're stuck with for the rest of your life. I work with patients directly all the time, and they come to me or other leaders to ask questions that I shouldn't be answering because it's not my place. I am not the doctor. So I believe that it's a problem in the community.
Yeah, I understand in what you're saying. If I were to make a recommendation, I would say ask questions. Always ask. It, it doesn't hurt to ask. So every time if you get a recommendation from a physician, healthcare provider, ask why this, why not that. The other thing is yes, we need to educate ourselves. We have to be mindful though of where we're getting our education from, making sure that we go to official seminars that are conducted by people in the healthcare who know MS, know how to treat it. I would, be careful about, just getting information from the internet that
Dr.
you don't know
Google,
what
avoid
source
Dr.
it came
Google.
from. Dr. Google, yes, avoid Dr. Google. So you got to make sure that yes, you get the information, but you got to get it from the right source. So this podcast is meant to teach patients about MS and MS management. And so this is one of the platforms. Several of my colleagues also uh, MS neurologists have YouTube videos online that, patients can log in and learn more about the disease itself.
Thank you for accepting my invitation and being here today. It was an honor to have you, and I miss you lots. Dr. Subei is now working at Neurology Consultants of Dallas. How can people that listen to this podcast make an appointment with you?
Thank you, Maite. I miss you too. And thank you for having me on the podcast. So we're here in Dallas, and our website is www.neurologydallas.com. And you can go in through the link and you can find our office and you can schedule an appointment through the website or just call our office number.
Does your office offer telehealth as well?
We offer, yes, in-person appointments and telehealth as well.
Well, thank you again, and I hope to see you soon.
Thank you. Same here. Take care.